Good evening, Professor. It's Raymond Burnett. It's regarding my first clinical journal. I'm so excited about my clinical rotation, and today I'm going to describe my experience in mental health and the reason why I choose the adolescent population to work with, and discuss any concern I may have regarding this clinical rotation, and furthermore identify my personal and academic professional goal for the clinical. At the clinic where I work, I see a few patients with mental illnesses, mostly addiction, substance abuse. I must say the mental illness is a vast and severe problem that must be addressed. According to the National Institute of Mental Health, about 1 in 5 adolescents in the United States has some type of mental health disorder. It is huge. Okay, I choose to work with this population because as a parent, I feel a connection with teen, adolescent, and also my desire to help the parents to overcome the stress and the challenges they may face with their child mental illness, because I have seen it, in my next door neighbor with her son who has a mental disorder. And I feel also sometimes the parents ignore and do not see the sign of certain mental illnesses. Moreover, they're not also educated to understand specific characteristic of a mental disorder. And my concern about the clinical rotation is it may not meet my expectation, meaning they not cover enough about adolescent mental illnesses, and my goal is to learn more about mental illness and mental health disorders in the adolescent population, like risk factors, what bring them to this situation, and how to assess them so I can diagnose them appropriately and accurately in order to manage the illness. And I feel like the parents also may need more help, more education, because if they understand the illness, they will deal better with it, and they will manage their children better. Therefore, it is my role as a provider to provide them, uh, to refer them to the appropriate person or team member of the mental health, so they can have some type of psychotherapy, and that can help them to manage the disease better. Because I have to tell you, that and I really understand that mental illness, it's really has a big impact in the adolescent population. And one an adolescent of the family as mental issue is reflect in all the family member. So therefore, better knowledge, better education will be not only not only help to manage better and understand, better, a better understanding of the disease, better management, and nevertheless, education is the key. Is prevention. Thank you, and I hope to see you soon next week for my next journal. Good night.